today we are going to be talking to you about some research we've done around the Germs Journey project, and I think a few of you in your room have already got our little Superstars boxes because you saw us out there earlier with it. So a little bit about the team that's going to be speaking to you today. I'm Professor of Microbiology and specialise in infection control. And we also have Professor Sarah Younie, who's a professor in education. And we have an associate professor of dementia, who's waving at you there, who are part of the team that have created what you're going to hear about today. So it's a really multidisciplinary approach to infection control, hand washing education for children and those living with dementia. So originally, many years ago, when my son was about 2, he wouldn't wash his hands, he liked playing with toilets, he didn't understand germs generally and was just a mucky boy. And I tried to find some educational resources that would help me about hand washing. There was lots of things on potty training, but the hand washing wasn't out there. So there was a gap in the market, as you might like to say. Now, as a microbiologist, I knew the science, but I was very aware that if this was going to be successful, I needed an expert in education. And in around 2015, that's when Sarah and I come up with the concept of a germs journey. So the mission of a germs journey is basically to make hand hygiene education free at the point of access globally. And we work very much from ground up. We work with stakeholders, and our ethos is that of co-creation. So we're not doing to someone that they're involved in the process of creating what is needed. And you will hear later on today, when Sarah and Chris are talking about the dementia book, how that was achieved with what we're going to, the book that we're going to show you today. So we originally started with a UK book for early years. It's very interactive. It's got something called thermochromic paint on it, which you touch and the germ appears, because that whole invisible germ concept to young children is really difficult. And also when we move on to the dementia patients that we're talking about. So we've got thermochromic paint on it, which is quite novel. You have to heat it up and then this germ appears, which was all wonderful till we developed a book for India and took it out there, and didn't work because temperature was over the temperature of the actual book, of the thermochromic paints. We learnt a lesson there. But anyway, so it's very hands-on. It's very based on images, which is really important for those children that can't read. We then created our website, which you can all go away and look at after the session or after today, and all of the resources, so workshops, games, posters, all sorts of things are on there for you to download and as you feel fit. And they're also translated into a number of languages because we've had challenges both in the UK and trying to make it as a global resource with cultural and language barriers. So we've worked really hard on that to make it accessible for all. So this game you can see here, you have to point an arrow, try and point where the germ is, click on it, and then a germ comes up and waves at you because you found them. So, for instance, on the bin. So it's all quite good fun. And we have resources there for the children, but also a grown-ups section, which is where you can download any resources that you feel would be useful in your healthcare setting. So what we also did was develop workshops, because the book alone is not enough to give information to children. So Sarah, as the expert in education, worked really well with our PhD students to come up with a method that would allow children to understand microorganisms, these invisible germs, infection control. So you can see here there's the books, the games, colouring sheets, the glow gel, which is fab whether you're a child or an adult, where you put the gel on your hands and then you illuminate it underneath the light, and you can see after you've washed your hands where you've missed. That's always a really big hit in schools. So as well as the educational resources, you'll see lesson plans and videos on the website that will allow you to pick up bits of the workshops that you feel would be relevant to your areas. So we took these resources, as I said, we did them in UK, we've made them culturally relevant for India, and Sarah also went out to Sierra Leone with a team and developed resources for West Africa. And as well as the team that are speaking today, we also had psychologists involved to ensure that we were looking at change in behaviour, because as well as changing understanding to prevent that infection spreading, the transmission, we need to change our behaviour, and that's much more difficult than increasing knowledge. So what we've seen generally is quite a big increase in understanding in young children. We've got to remember not all of these are reading yet. A 40% increase in understanding, and this lasted for a month post-intervention, which when you're thinking about children is quite a long period of time because they forgot, well, I don't know about your children, but if you've asked them what they've done at school that day, they say they don't know like 2 hours after they've left. So the fact that they could remember this for an extra month was really useful. In India, where we were working in the slums and we had illiterate children, that increase was even greater. We were looking at 60 to 73%. So these are children that really understood those culturally relevant images. And that was retained for quite a long period of time. We went back over a 3-year period. So behaviour, we did a study in schools, but we also created the Think Tank Museum. We're doing a STEM museum exhibition, and we created a magic mirror that had a song that come out that taught the children how to wash their hands. And our thinking was, can we change behaviour in a few minutes in a public space, as well as in school with workshops? And the answer is yes. So we looked at behaviour for this, and what we saw was quite an increased behaviour in where the children were washing their hands, so in between their fingers, the wrists, under the nails, were the key things where we saw increased hand washing behaviour, because everyone sort of got the soap and water and rubbing the hands together, or the tickle fingers as I call it, or just under the tap. But generally we were getting a big change in behaviour. And the other thing that we've done for paediatric wards, and some of you in the room have already picked these up, is the SOPA stars. And this was in collaboration with MediPal. So in here we've got little packs of hand washing products, games, and we've got a clinical trial in hospitals going on at the moment. But we can also see where these may be useful in the care home setting for those living with dementia and intergenerational policies that Chris is going to speak to you about in a moment. So we have 10,000 of these, so please do come and talk to us if you think there's somewhere you could use them. And you can see all of our SOPA stars there, which we spent a Christmas coming up with names, so that was good fun. And there you can see the products for those that haven't opened them yet. We have got 3 boxes left. So now I'm going to hand over to Sarah to tell you a bit more about the dementia book.
So welcome everyone, and thank you for coming to our talk today. So my name's Sarah Younie, which my students think is hilarious because they're at uni and they've got a Professor Younie, which amuses them, although it's spelled in my surname the Scottish way. But as we said, Katie approached me as a microbiologist back in 2015 to create a book for young children. And we did that around infection control and hand washing, as we've said. But when the pandemic hit, our publisher contacted us and said, could you do something that will help young children understand the transfer of virus infection? And that's when we developed a new book that was Bye-Bye Germs. After we did that, it became apparent to us that there was also the issue of elderly people, and particularly those that were living with dementia, that it might be helpful to remind them around the importance of hand washing. Now, just as Katie had approached me about education expertise, I was aware that when it came to cognitive care, we also needed greater expertise, and that's when we were delighted to connect with our associate professor from Montfort University, Chris Knifton, and his background, which he'll tell you about, is as a specialist in cognitive care and dementia, and he will tell you about the teaching he does, but it's mainly with our nurses because we're all from a Faculty of Health and Life Sciences. When we approached Chris to help us readapt the book We're Done for Children that the publishers asked us to do, and we wanted to create it to be more relevant to those living with dementia, we then worked in a collaborative way with a focus group from Trent Dementia Care so we could co-create a brand new book that was relevant. And we knew that when we were speaking to Chris that we needed to link into care homes' intergenerational policies. So Chris will explain how we came to do that link with more general government policy and drive on that, and then I'll come back and say more about the book.
Thanks, Sarah. Thank you, Katie. I guess for those of you who've not met me, which is probably everybody, my name is Chris. By background, I'm a learning disability nurse, psychotherapist, social worker, and admiral nurse. And I like talking to care homes because when I first started out in the world, and I have autism, so I struggled quite a bit. And the first place that made me feel welcome in healthcare was a care home. And I stayed in that care home for 10 years, working as an activity organiser. Then I went back when I qualified as a staff nurse, and then I became care home manager. It was a 60-bedded dual registered care home. So I've got an awful lot of support and time for care homes. And I don't know if there's any NHS colleagues in the room, but I preferred working in the care home to NHS. So I hope that doesn't sound rude, but I'm autistic, I don't lie, it's true. I prefer care homes and I love them. So, the whole idea about where we're going... has anyone heard of admiral nurses? Just out of interest. Cool. I'm one of the very rare... I think there's about 300 of us in the world. I mean, it's only a UK thing, so it's UK, but I say the world because it sounds better. 300 of us in the world. I'm an admiral nurse. If you've not heard of us, we're nurse specialists who focus on supporting carers of people with dementia, as well as people living with the condition themselves. So certainly in the realms of care home work, it can be supporting carers and visitors. It can also be supporting staff who are struggling, or often in my line of work, I found staff are struggling because they have got experience themselves of a relative with dementia, and now they're coming into care work, which is why they went in, and then they can see deterioration in their clients, and then they're self-reflecting and the impact that has on them, thinking, is this what my mother's going to be like, etc. So I've done some work working with carers who are almost doubly affected and how to support them. And I guess I was quite excited when Katie and Sarah approached me, because reflecting on some of my work in the care home and why this is important, this isn't about a book. You give someone with dementia and say, look at this children's book. Now, let that help you how to wash your hands. That's not the point of it. The point of it is, and if I go back to a little story, when I was a care home manager, some relatives came in and said, Chris, can you help us? And I said, why? What's the problem? How can I help? And they said, Grandma's got dementia and the grandkids want to visit, but the grandkids don't know how to communicate with Grandma, and Grandma's forgot how to communicate with the grandkids. What can we do to bring people together? And this is where this idea comes from my perspective. So I'll take you through it a little bit. Essentially, this focuses on concepts of intergenerational policy and working. It's a policy you may have within your care home. It's something you may not have at all, or something you've not heard of, because it's come in and out of fashion. The whole point about intergenerational policy or practice or programs, depending how your individual organisation calls it, if it does, is about how we unite younger people with older people and working practices. Now, in the idea of dementia and cognitive impairment, neurocognitive disorder is a new term for dementia, but we'll use the term dementia for now because it's probably one we're most familiar with. Do you all know how many different types of dementia there are out there? 256, so loads of them. But we've got 4 common ones, and when you're designing something, actually what's workable for one type of dementia may not be workable for another type. And that's even before we get down to the basics of person-centred care and different biographies, etc. But one of the things we find quite common in dementia is a loss of hope and a loss of feeling useful. And that can cascade down to an awful lot of well-being ill effects. So one of the ideas about promoting a sense of feeling useful, restoring well-being, is to allow someone, or facilitate an opportunity, I guess, is probably the better word, facilitate an opportunity to regain their familial social role as a grandparent. And what do grandparents do quite a lot is to teach I've got to be, I hate them, but little children, teach them how to wash their hands properly. So here's a book, essentially, where I'm the grandparent, I've got dementia, the grandkids visit, and I can now restore my role as a grandparent, and I can teach them how to wash their hands. And that's an important adjunct to intergenerational policy and working, how to connect children with older people. What I do appreciate is not all people with dementia are old. There are, for example, 17 juvenile dementias, which are dementias that only affect children. There are also the younger onset dementias and then the older ones. But for the purpose of this perspective, we're looking at the older people and younger people and how they can work together. So that's where we're going with this. So just remember in your mind, this isn't a book on how to teach people with dementia to wash their hands. That could be a side effect of it. Essentially, it's a book to promote, let me maintain my role in terms of supporting my grandkids, because that's the one thing that will put a smile on my face. And you've now given me an opportunity to do that. That's the underpinning current behind intergenerational policy in this context. So, a little bit about the background to it. If you don't care about background, close your eyes for a second. But this is the theoretical bits. Essentially, it's been happening a long time, since the 1990s. They didn't used to use it with people with dementia, and then they thought, oh, I know, let's give it a go. They tried it, and it didn't work, so it was ignored. It didn't work because the research was crap. Oh, no, I can say that. The research was rubbish or needed further development, and therefore it showed it wasn't workable. However, since then, we've got a better idea of how to work with children, a better idea about dementia, a better idea about how the cognitive areas in the brain, if you've got frontal temporal degeneration, it's a different way of thinking than if you've got hippocampal or temporal lobe problems, like in Alzheimer's disease. So if we understand what part of the brain is wrong, not working, we focus on the parts of the brain that does. So the parietal lobe, great, now I know the parietal lobe is working fine. What things do I do to stimulate parietal lobe to create a connection? That's the idea. Now we know that, we can then develop better intergenerational policy and working with people with dementia that's now going to work. We're not presuming dementia is just this one group of people. They're very separate things, even from a medical model, we can use that. So that's where we're going with this. So the whole idea about, well, why is this important? We're seeing a slight surge. It's still low, but we're seeing a slight surge, and it links very well with person-centered care, family, dementia-friendly practice, and relationship-centered care. And person-centered care is about the person. Relationship-centered care broadens it. So it's not a didactic, person with dementia and the carer. It's person with dementia, the carer, the family, the network. And this book, we're hoping, is something that can be used in that context, address loneliness, support well-being, and most importantly, allow people to regain their familial role. So, in summary, intergenerational working links with a dementia-friendly community policy and practice. So if you're thinking, I want my care home to be dementia-friendly, how does it incorporate relationship-centered care? And intergenerational policy and practice is one way of doing that. It can address the impact of loneliness because you're giving a vehicle to establish connections. It addresses feeling of being cut off from society and family life because now I've got a role to play. And imagine if you didn't have a role or that role was taken away from you, what that does to your self-esteem. It's not going to work for everyone, but it's something that could do. You're building your toolkit, as it were, to provide opportunities to facilitate well-being. And when people say, I'm a dementia care specialist, I tend to say, so what do you do that's dementia specific? I don't mean your falls care plan or your mental capacity care plan. That's for anyone, particularly with frailty. Where's your dementia-specific care plan? And if you ain't got one, why are you saying you're a dementia specialist? Because you ain't got anything dementia specialist. This is potentially one example you can stick in your toolkit. So, I think this is my final slide before Sarah. So the whole idea about intergenerational dementia care is bringing together people living with dementia and children, but for a specific purpose, not just for the sake of it. And the purpose here I'm focusing on is the people with dementia and psychological well-being. So when I was going to look at the impact on children, because I don't like them, but in terms of dementia, I know it can have a huge impact. Stimulates communication, shared experiences, build familial roles which may have been lost. Think about that. If your hippocampus has gone wrong in Alzheimer's disease, you're focusing on your long-term memory, those are the things you need to build upon. Those are the things that are working, so let's develop that. Great sense of belonging and feeling useful. Provides a sense of purpose. Yeah, bring them in. I'll show them how to wash their hands. That sort of idea. And an overall feeling of psychological well-being because you've established usefulness and hope. The two things that people lose, which people rarely know how to focus on. Here's a potential opportunity. Sarah, your go. Oh, another slide. Oh, I've got another slide. Hang on. It's a novel approach, as you probably guessed. It's a vehicle, positive well-being and mental health promotion, reduced loneliness, respects the person with dementia and their familial role, and develops and combines person-centred care with relationship-centred care. Your go, Sarah.
Great, so you can see why we were delighted to collaborate with Chris on the project. For me, it's very close to my own heart as my father has diagnosed Alzheimer's, and he was really important to my own education by always encouraging me as a quiet young girl to carry on learning. So as he's struggling with his hippocampus, it's really nice to have created a resource where with his grandchildren, he's now able to have a book that has actually been created with people living with dementia, where he can use the book with grandchildren. And developing this wasn't at all straightforward from mine and Katie's perspective, in that we thought, here's a children's book, now let's adapt it. It was only when we started working with the focus group that we realised, actually, facial expressions, words that are used, even the colour of the paper in the children's book was not appropriate for those that have cognitive impairment. So we made sure that we worked with end users to ask them, well, how do we reformulate the images on this page? What kind of words should we be using? So as we said, we worked with Trent Dementia as a focus group, and in it we went through page by page what the illustrator had created with us and the words that we had come up with originally. And when we were working with children, the actual science that we wanted to communicate was called funky facts. And straight away, the focus group said that's really not appropriate. We don't like that. And we've now called that, for example, an important fact. Some of the expressions weren't appropriate, some of the backgrounds weren't appropriate. So, for example, on this page, we changed the setting so it looks more like a care home setting, so it is more familiar with the adult that has the book that they're looking at with a child. Another interesting feature for us, and it's something that Chris has said before to us from his earlier research, is that the colour of the paper matters. So if you're working in a care home setting with someone that has dementia and you're wanting to work with any paper-based materials, make sure that the background is a buff colour or a pale yellow colour, because it can make a difference to how the words are read. So it was things like this that were really helpful that our research was able to highlight for us, and which the publisher was willing to work with us. Our publisher is Medina, and they're actually based on the Isle of Wight, which those of you that know the Isle of Wight will know there's a disproportionately high percentage of elderly living on the island, and there are a lot of care homes there, so we were able to work more directly with the local population there as well. We've been able, through donations and some funding from Barclays, to print a number of the books and to give those out to care homes across the UK. And these are a selection of those that have had books. And we also have some left. So if you're interested and would like to take a book away, we're going to kindly invite you to partake in our research, which would involve having the book, taking it away, and then us asking if you'd kindly fill in a questionnaire that will just ask you some simple questions about the use of the book. We do want to link into policy discussions, and this is what we did last year, and I'll let you read through these quotes that we had with both the Scottish Government and with care home leader groups about how they found the book to be very helpful, particularly post-COVID, when we know in care homes it was really hard for those families that could no longer have visitors, and how heartbreaking that was. So we also wanted this resource to come post-pandemic to rebuild those familiar relations. And as Chris said, we know how important that is to well-being as well, and to give those living with dementia a sense of purpose and that familial role as either a grandparent or an aunt or an uncle. So what we'd like to do at the end of our speech today, or talk today, is to invite you to be part of the research, and we will ask you just to kindly leave your name and an email and ask if we can contact you. And then, as I say, we've got a few books left today to give out, and we're also here if you want to ask any questions as well. So thank you for listening.